Right now, just when the world thought that we've seen the back of the pandemic, a new virus variant has hit us. And if data point is anything to go by, especially from Europe and from US, looks like we could be in for a tough winter. We could be in for a tough winter, but are we in for a dark and a scary winter? As long as it is tough and manageable, I think there's nothing to worry. But what are the chances that the spread can become dangerous? And in India, now that the virus has reached a triple digit mark, what about the preparedness? Let's discuss that and all that and much more with Viren Shetty, Executive Director and Group COO with Narayana Health. Viren, good morning. Thank you for joining us. I guess my introduction itself was the question. Looks like we are in for a tough winter. What is your sense? Tough and dark or only tough?
It's always bad news when you get me on your shows, but I wouldn't say there's cause to be so gloomy yet. Given what we're seeing in Europe and the US, this variant has quite a massive spread. It does spread much faster than even Delta, which means that it should start to go to a large amount of the population in about a month's time. But that's not what's important right now. Everything that we know about this so far indicates that it is a much milder variant. It does have a much greater ability to break through to people who are unvaccinated or slightly immune compromised, as well as those who have taken the vaccine. But ultimately, what counts at the end of the day? Whether you end up in the hospital, whether you require a ventilator, whether ventilator is available for you, and whether you're able to get the treatment that you need. And the kinds of treatment that is required for this disease hasn't changed in the past 1.5 years. We know the drugs that are required. We've got enough experience dealing with it from the last outbreak, and we just apply the same lessons. Now, as hospitals could get overwhelmed, that always remains a small possibility. I would like to hope that it's unlikely because so many people have already so much immunity, and there may be a lot less people coming to the hospital, but definitely, given that India is a country of 1 billion people, even a small chance of infection 0.1, 1%, whatever it is, does mean millions and millions of people.
Viren, why is there a lot of back and forth communication on the booster shot? There is one theory which says that look, this virus is essentially jumping the effectiveness of the current vaccine. If that is the case, then why are developed markets and very smart medical professionals making a case for a booster shot? If it is jumping the original virus, if it is jumping the vaccine protection, then even a booster will not work.
No, I'll explain this to you. See, with traditional flus, SARS, H1N1, you do need annual flu shots. It's not very much a practice in India, but in the West, they're very used to the idea that you get your annual flu shot. Those of us that work in the healthcare sector have always known that you keep needing to get a new shot every year because unlike, let's say, measles, mumps, or smallpox, where you just need a vaccine once and it requires lifetime immunity, with viruses, they evolve very quickly. And so every year, when you're getting a new vaccine, you're essentially getting a modified version to deal with whatever mutated thing that's happening. It's just that this COVID is mutating at a much faster pace. And so for some people, not all, for some people whose immunity may wane with time, they are recommending for older people, immune compromised people to get a booster so that it ups your immunity. Now, whether having a higher immunity is directly linked to whether you will get infected, to what extent you get infected, whether you end up in the hospital, that still requires a lot of studies. But this is one of those better safe than sorry situations. And so in the West, those with resources and those with adequate vaccine doses, they are recommending people of a certain age to get boosters because it can't hurt and it could only help. Now, to what extent it helps, you'll have to do an essential cost-benefit analysis. The incremental benefit that comes from one more dose measured against vaccine that would otherwise go to people who have not been vaccinated. And that's what resource-poor countries like us need to worry about.
So if I work with a timeline and if I say by 15th of Jan or hopefully by end of Jan, we will get a clarity on whether we are in for a third wave or not, and medically we would be in a position to determine that?
Determine what?
Whether we are in for a third wave or not, or whether Omicron will spread in India or not. Do you think in next 2-3 weeks we'll get clarity on that?
See, we're not genetically superior to other races. If it has happened in different parts of the world, it's quite likely to happen here. Now, to what extent it will spread and how fast or how quick, that no one is able to say, because there's simply not enough resources to model and map out everyone. You can make best guesses. You can say January, you can say February, you can say next week also. Nobody knows. The fact is, how severe it's going to be should not any longer be measured by the total number of cases, because the cases are meaningless if you have mild symptoms, right? It should be measured in terms of how many people end up in the hospital and what proactive measures can be taken without going back to things like lockdown, flight ban, and things that have been tried many times before and haven't worked. Sometimes just simple precautions, masking, avoiding crowded places, and just exercising utmost caution is much more effective than just outright ban, because it doesn't really stop spread, as has been shown many times before.
Good morning. That's the point as well. Life has to go on. So I wanted to actually ask you, what is it that doctors, healthcare workers, frontline workers would want from the government? Some kind of lockdowns, night curfews during Christmas, New Year parties. What is it? Because the healthcare workers also must be tired after 2 years. It's been a relentless, non-stop fight.
I would agree. See, I can't speak for all healthcare workers, but at least among the colleagues that we have and people that we represent, it's been evidentially proven that lockdowns haven't stopped the spread. It may delay it by 2-3 days, a week, a month maybe, but it doesn't stop. So it really is quite a draconian pursuit to do the same thing that has been tried twice before to very little effect. Again, given that our economy is just limping back, given that children are facing such a huge learning deficit, given that farmers are not able to sell their produce, shopkeepers are not able to keep their shops going, we're a very poor, we're not as developed as the West that can put a lot of stimulus towards this. We need the economy to get going for that. So from a larger societal perspective, it probably does not make sense to go for any kind of lockdown. But if things can be contained, if things can be measured and managed in a more micro contained level, if people are more disciplined about wearing the mask, if you're able to enforce less crowding in indoor, poorly ventilated areas, then of course you can limit the spread, or at least spread it out over a much longer period of time. But this sort of wave is inevitable. The only thing is to measure the severity of the wave in terms of how many people end up in the hospital. And that's something is yet to be determined.
Just taking forward from the question, Nikunj is also asking as far as the booster shot goes. Of course, the final call, we're being told, will be after a series of meetings, whether it's the NTAGI, there are some at the Prime Minister's office as well. Has the government been engaging with professionals like yourselves, hospitals like yours, on this issue?
Not that I know of, but I know that they do consult with experts across the world, not just doctors in India, but doctors all over the world. It's just that there's no global consensus on this. And we're at this phase now where even if it were to start from tomorrow, it really won't make that much of a difference, because it's very difficult to ramp it up in such a short period of time. But it is something that has to be planned as part of our annual vaccination strategy, where COVID boosters become an annual exercise. I feel like that would be inevitable, just like it is for flu and other things that require boosters.
One final question. Is life back to normal for Narayana Health? When I say life back to normal, the non-COVID business, the non-critical surgeries, how much of that business is back on track?
Our life back. So our normal is people falling sick for other things, people coming in for their heart surgeries, cancer surgeries, people coming in for neuro, brain operation, dialysis, transplant. Then yes, hospitals have been functioning as normal as can ever be. And in fact, even slightly more than that, because there is so much backlog that we're dealing with. So in most of our hospitals, we are consistently running full OT lists for the procedures that have been delayed for this long. We're waiting to see what happens with COVID. Either way, we are prepared. All our infrastructure has been geared to take care of this. All our wards have been converted to include oxygen. We've bought all the oxygen generators. We've stockpiled and medicine. So if it behaves in the same way that happened last time, at least for all major hospital groups, will be able to take care of this. That we're feeling a lot more confident about this time around.
Really appreciate your time. Stay safe and best wishes for 2022.
Thank you.